My name is Luunga Ziko. I'm going to share with you a study done at the adult hospital, the University Teaching Hospitals in Lusaka, Zambia. We looked at the etiology and prognosis of community-acquired pneumonia. I was the author and the co-authors are listed below. So pneumonia is one of the leading causes of hospitalization and mortality, both in the high-income countries as well as the low and middle-income countries, contributing as much as 3.2 million deaths in the year 2015. The etiology is influenced by geographical location, demographics, climate, and resource availability. We tend to see similar organisms isolated in the different parts of the world, but the frequency and the distribution of these isolates tends to differ. So in Zambia, very few studies have been done on pneumonia, but we still see it as the second leading cause of mortality. When we look at various statistics from different hospitals, the University Teaching Hospital, Livingstone General Hospital, and various statistics, we actually see pneumonia as one of the top causes of mortality countrywide. When we look at the literature review, we actually note that Streptococcus pneumoniae is one of the most common isolates. This was seen in a study done in Nigeria, although there was varying resistance even to the commonly used antibiotics such as coamoxiclav, ceftriaxone, and the macrolides. Resistance going as low as high as 50%. We also saw in two other studies done in Kenya and another in Zambia, which was done in the pre-HIV era, which also isolated Streptococcus pneumoniae as the most common isolate. We also noted that Mycobacterium tuberculosis is one of the leading causes of pneumonia and mortality as well. This was noted in a study done by Nyamande in South Africa and a more recent study by Mateo in Zambia, which was focused on adult HIV-infected individuals with severe immunosuppression with C4s less than 200. So the main objective of this study was to investigate the etiology, presentation, and prognosis of pneumonia at the adult hospital. And the specific objectives were to identify the microorganisms causing pneumonia, look at the clinical characteristics, as well as determine the 30-day mortality in these patients. So this was a prospective cohort study done at the adult hospital in the medical emergency unit, the medical wards, the intensive care unit, as well as the outpatient department. 337 patients were recruited between March 2018 and December 2018, and only those above 18 years old and met the WHO clinical definition of pneumonia for resource-limited settings. The clinical characteristics and laboratory data were collected and sputum samples were submitted to microscopy, TB diagnostics, and bacterial cultures. Of the 337 patients that were recruited, 327 were included because 10 could not complete study procedures. And after excluding a number of clients, we had 107 patients with complete data. However, it's important to note that there were some patients who had missing data and were still included in the analysis of this study. So these are the basic characteristics stratified by HIV status. And of the patients that had a non-HIV status, 71% of them were HIV infected. Cough was the most common symptom among these patients. And other symptoms were chest pain, fever, and breathlessness. The most common physical finding was crackles, and this was, of course, noted from auscultation. The potential pathogens isolated from sputum samples in these patients, top on the list was Mycobacterium tuberculosis, which was found in 1 in every 5 patients. Candida species were also very frequently isolated, but a more notable finding was that the gram-negative organisms were found in at least 30% of the patients. And the gram-positive organisms were very, very scarce in this particular study. Mycobacterium tuberculosis was noted to be associated with increased mortality, whereas the other isolates were not statistically significant for association with increased mortality. So the conclusions are that cough was the most common presenting complaint among the adult patients, followed by chest pain, fever, and breathlessness. And of course, respiratory crackles were the most common physical finding on examination. HIV prevalence in the study population was 71%, but was not associated with the isolation of different pathogens from the sputum samples. And Mycobacterium tuberculosis was the most common cause of pneumonia, found in 1 in every 5 patients with pneumonia. Candida species were also quite frequently isolated, constituting about 18%. However, their significance was unknown because we were not able to speciate, and so we do not know whether these Candida species were colonization or were actually pathogenic. The gram-negative organisms were isolated in about 30% of the study population, and mortality was about 30%, and infection with Mycobacterium tuberculosis was associated with increased mortality. So what we note from this study is that the causes of pneumonia from this study setting differ from the various previous studies that have been done and would mostly not be covered by the empiric antibiotics such as the penicillins. We note that this was a tertiary hospital where patients from various facilities would be referred to after initial trial with some of the empiric antibiotics such as the penicillins or the second generation cephalosporins. And so it's possible also that these patients could have been exposed to antibiotics prior to admission to this facility, and by the time they were being enrolled onto this study, they could have had resistant organisms already. And so this could also explain the high mortality rate of about 30%, which we noted in this study, because these clients or patients would not respond as they were not being treated for the right organisms in most instances. We also take note that in this resource-limited setting, mostly patients do not submit sputum samples, and they do not submit sputum samples, or we may have no reagents for us to actually have appropriate microbiological diagnosis. So this emphasizes the value of microbial diagnostics as well as the need for locally informed treatment guidelines. With this study being done at a facility like the University Teaching Hospital, it would be important to do a multi-center study involving various health facilities in the country and in different settings so that we have locally informed treatment guidelines. That's the end of my presentation. Thank you very much.